Welcome to you. And this is my presentation on MaRIS, the application of contemplative pedagogy in medical education. I'm doing this presentation under panel 5, examining humanistic approaches to health and well-being. In the next 15 minutes, I'll be talking about the model that we developed in the Griffith University School of Medicine. How do we use a humanistic approach to improve health and well-being through medical education? So first of all, I'd like to acknowledge the country. I would like to acknowledge the traditional custodian of the land on which we are meeting and pay my respect to the elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people. So when you reflect on my topic, the using of contemplative pedagogy, first of all, contemplative pedagogy is a response to what's happening traditionally in higher education, where it's dominated by a third person. So it was a didactic approach with focus on teaching students new information. When we talk about contemplative pedagogy, we means that we want to shift the focus of teaching and learning to incorporate the person, the students that we're teaching. So we change that into a first-person approach, which connect the student to their lived, embodied experience of their own learning. In my way of applying that, I use that as a student-centered education. So there's a few methods to go about with applying contemplative pedagogy that includes mindfulness, reflection, concentration, open awareness, sustaining contradictions, and beholding. So I assume that majority of you would know what mindfulness is. That's being present at the present moment, having the ability to be present to the thoughts that's flowing through your mind and not being distracted by it, being able to focus on what you want to focus on, at the same time, be aware of what's going on. Reflection can be done in many, many ways. It can be cognitive reflection. And in this particular approach that I do, we focus on affective reflection. Concentration is straightforward as it is. That's the ability to be able to focus. And as we know, being able to stay focused is beyond just wanting to do it. An individual needs to have the skills to go through training to be able to concentrate. Open awareness is that sense of openness, of being present, being aware of what is going on, and at the same time being able to be focused and not, let's say, be selective of what we want to pay attention on. Sustaining contradictions is very, very important because the world is not entirely black and white. How are we able to sustain when things are in opposition of each other? And that is an important tool to utilize. Beholding, from my perspective, is the ability to be present again, of being able to hold or be present in whatever situation that you're in. So those are the things that you can use to apply contemplative pedagogy. And in Griffith University School of Medicine, we used that idea and we created this module called MaRIS. So MaRIS includes mindfulness, as we mentioned earlier, and the AR is affective reflection, as I mentioned. And then we have impactive experience, where we introduce impactive experience into the classroom. And throughout that, we do all this in a supportive learning environment where the student will feel being supported. So we wrote what we did into a article that's being published in Medical Teacher in 2020. And it's open access. So any one of you who is interested in the article. You can just pretty much Google Beyond Communication and MaRIS, and you'll be able to find the article and read it. So, as I briefly introduced just now, the M in MaRIS is mindfulness. It's being able to be present, to be aware of the thoughts, and be able to be focused with what you choose to focus on. Effective reflection is when, in the process of using the module, we ask the learners to describe what's happening to them with special attention or focusing on how they felt. Because we think that feeling is the key to our value and belief systems. And if we just continuously reflect cognitively, we won't be able to have in-depth reflection. So through feelings, hopefully, the individual will be able to learn more about themselves and hence be able to identify what is needed for them to change and how they're able to do things differently down the track. So the affective reflection component would start with the student writing a journal about selective workshops, 300 to 500 words. And we then will often give them feedback so that the student can realize whether they're doing the affective reflection correctly, and be able to then use further techniques to support the student in affective learning. So we use interpretative phenomenological analysis based on the Korsbrough and Bloom's levels of learning. So then we will be able to facilitate the student to then move on to doing a summative assessment to enhance their engagement in the process. So the application of mindfulness in what we do is we run these communication skills workshops where the student actually practice mindfulness before the workshop starts. And then we introduce simulation into the workshop, which is the I component, which I'm going to talk about that later. And then affective reflection comes into play. So if we move on to the next slide, it will go into what I is. So the emotional impactive learning experience. So the course that we apply the module in is the communication skills stream, which I am the stream lead, where we actually have a lot of simulated learning component in there. For example, we will have simulated patients, which are actors, coming in role-playing how they're impacted by everyday life, how the illness is impacting on them, even how they would be receiving bad news that's being delivered to them. So all of this interaction, as far as the student is concerned, can be perceived as impactive learning experience. So when we introduce the impactive experience through simulation, the student would then have reaction or response to what is going on. So we start by just workshop, and we also then evolved into simulation hospital, which could be a week long for those impactive experience. So if you reflect a bit earlier, throughout this whole process, no matter if it's a workshop or it's a simulation hospital, mindfulness is always the undertone of it. And at a selective point, we invite the student to do affective reflection. So because it's can be equally like a real clinical experience, so it will be impactful for the students, and like it says here, it's less predictable. So the students are constantly being present to whatever that could happen to them. So then we provide the supportive learning environment to facilitate MaRIS, which includes facilitation. We make sure that they stay in the same group so that they feel supportive. And we also laid it out at the get-go that this is a safe learning environment. Okay. So our research shows that the students' competence in communication and their ability in developing empathy response and the ability of resilience actually increase in the time that we apply MaRIS. So this research is specifically done for when they are doing their communication skills training. And of course, like the example that I gave you just now also involve their further year practice. So for example, mindfulness in the Griffith Medical Program, it's embedded in all 4 years. In year 1, we gave the student a 30-minute introduction, and then we have 19 workshops where they spend a brief 3 minutes doing mindfulness and go into the workshop for simulation learning experience where the MaRIS module will be applied. In year 2, they have 6 of those sessions. And in year 3 and 4, that is where the week-long medical simulation medical hospital experience that I spoke about. Just keep in mind that this is all done, the research are done in 2017, and the Griffith Medical Program is now going through a process of improvement. So changes are on the way, but this is where the research is being done. So on reflection of MaRIS, how does it link up to Humanistic Buddhism? I guess the most important concept that it resonated with is when the Venerable Master Xing Yun introduced the idea of self-awareness and practicing the Buddha's way. This is written in one of the articles that's available called The Essence of Humanistic Buddhism. When the Venerable Master introduced this concept, it's a very powerful idea, knowing that as a humanistic Buddhist practitioner, us having self-awareness and practicing the Buddha's way is a very, very important key thing that all practitioners should embark. So MaRIS pretty much embodied that way of approach, because we introduce mindfulness into our medical program teaching. We invite the student to perform affective reflection. So by the two of that is a really important component of that development of self-awareness. Because a lot of the time when we're engaged in just cognitive learning, we're not really able to engage with how we felt and how we are reacting to the external world. So having the ability to be aware of ourselves is crucial. And at Griffith University, the School of Medicine, we did that through providing a supportive learning environment, introducing impactive experience, training up the student with mindfulness, inviting them to do effective reflection so that they can create self-awareness. And from the self-awareness, they then learn and plan how to perform or how to interact clinically in the future, which in the humanistic Buddhist practice way to look at it is actually practicing the Buddha's way. Of course, in this context, I'm using the Buddha's way is very, very broadly. It doesn't mean that you must be a Buddhist. As far as I'm concerned, the Buddha's way is the way to benefit others. So in our medical program, we try to put this together to facilitate our students to develop self-awareness, and it improves their ability to empathize, it increases their resilience, and increase their competency in communicating in clinical setting. Other than self-awareness and practicing the Buddha's way, I also see that the MaRIS approach also encourage openness and coexistence, because through MaRIS, through reflection, through understanding other people's lived experience, you realize that we are all interconnected, and it is all about how can we coexist in this world. The other concept that it really comes up through the practice of MaRIS is also through deep reflection. Our students then learn more about what is the true application of being respectful and being tolerant. Because, for example, clinical world is always challenging with COVID, with anti-vaxxers. We all need to be able to practice respect and tolerance, and hopefully we find a way out of this pandemic. So in short, in 15 minutes, what I would like to invite you to reflect on is, in our medical program, we use mindfulness, effective reflection, introducing impactive experience in a supportive learning environment so that we can train our students to be more resilient, empathic doctors for the future. Thank you very much for your time and attention, and we'd really like to hear from you what questions you have, and looking forward to our discussion. Thank you.